The role of HCG in ectopic pregnancy. If you're wondering how HCG levels help in diagnosing and managing ectopic pregnancies, you're in the right place. Let's break it down step by step. First, let's talk about what HCG is. Human chorionic gonadotropin, or HCG, is a hormone produced by the cells of the embryo after it implants in the uterus. In a healthy pregnancy, HCG levels typically double every 48 hours. Now, when it comes to an ectopic pregnancy, things are different. In an ectopic pregnancy, the embryo implants outside the uterus, usually in a fallopian tube. Here, the HCG levels often don't follow the usual pattern. Instead of doubling every 48 hours, the HCG level may increase less than 66% in that time frame. To diagnose an ectopic pregnancy, doctors often look at the HCG levels in combination with ultrasound findings. If the HCG level is high enough, usually above 3,500 μml, and no gestational sac is visible in the uterus on an ultrasound, it's highly likely that the pregnancy is ectopic. Here's a key point. If the HCG level is rising slowly or decreasing, it suggests that the pregnancy might be ectopic. For instance, if the initial HCG level is less than 1,500 μml, it should increase by at least 49% in 48 hours. If it's between 1,500 and 3,000 μml, it should increase by at least 40%. If it's above 3,000 μml, it should increase by at least 33%. Another important aspect is the discriminatory zone. If the HCG level is above this zone, typically around 3,000 μml, and no gestational sac is seen on ultrasound, it indicates a high likelihood of an ectopic pregnancy. In terms of treatment, HCG levels play a critical role in determining whether a woman is a candidate for medical management with methotrexate. For methotrexate to be effective, the HCG levels should be below 5,000 μml, and the ectopic mass should be less than 3.5 cm with no fetal cardiac activity. If methotrexate is used, the HCG levels will be monitored to ensure they decline. If the levels do not fall, additional doses of methotrexate may be needed or surgical intervention might be necessary. In summary, HCG levels are a vital tool in diagnosing and managing ectopic pregnancies. They help doctors determine if a pregnancy is healthy or ectopic and guide the decision on whether to use medical or surgical treatment. Monitoring these levels carefully is essential for ensuring the best possible outcome.